And coronavirus killed 50 Texans yesterday, the largest one-day total. I'm joined now by Governor Greg Abbott to talk about the ways the state is trying to prevent the spread and reopen at the same time. Thanks for being here, Governor.
My pleasure. Thank you all.
The White House recommends the number in cases trend down for 14 days before we reopen. So we've plotted those numbers for the last 14 days statewide. They're up and down daily, Governor, with some steep increases just this week. According to these numbers, we're not seeing that decrease. What do you say to people who are worried about reopening too soon?
Very importantly, the decision to reopen was made on the basis of advice from doctors, including Dr. Birx from the White House, who looked at our plan, who looked at the numbers, who said that Texas was perfectly fine to go ahead and open, understanding this fact, and that is the number of people who are tested and tested positive is not the relevant information. All the doctors say that what is important is the percentage of those who test positive. Because remember this, we are testing more people every day. The more people we test, the more people will test positive. If you were to be told that we were to test 2,000 positive tomorrow, that fact would be irrelevant. What would matter is the percentage of people. If we tested 100,000 people tomorrow, but only 2,000 people tested positive, that would be great news. So using that as the equation, what's important for everybody to know is that the numbers actually will increase as we move forward because we are testing more people. What has happened is from mid-April until now, the percentage of people testing positive has been cut in half. And so the trend line is going in the right direction. Dr. Gottlieb, all the doctors nationally talk about this, say the two factors that matter the most is the percent who test positive and the hospitalization rate. Our hospitalization rate has continued to decline. Unlike New York, New Jersey, Louisiana, all these other places, Texas has never had any challenge with our hospital system. Our capacity has been plentiful, and we've never had to tap into our ventilators, our ICU units. Our hospital beds have been abundant, so much so we had to let doctors and nurses go back to treating everyday maladies so that they could take care of the public health of the people here in Texas.
Many Texans are afraid to return to work but don't meet the criteria to stay at home, Governor, so they would lose unemployment benefits. What do you say to them?
Well, what the Texas Workforce Commission came out and announced is that there are multiple categories of people who are exempted from that, understanding that some people may not be able to get back to work. Let me give you several of the categories, and by the way, for your audience, these categories of exemptions provided by the Workforce Commission can be found on the Texas Workforce Commission website or on the governor's website. Because we want to protect our most vulnerable, if you are 65 years or older, you are not required to return to work at this time, or if you live with somebody who is 65 years or older, because we don't want someone going to work, maybe bringing COVID back home to a person who is 65. Secondly, if you have COVID, you're not required to return to work, or if you live with someone who has COVID, you're not required to return to work. If you're subject to a quarantine status, or there's all these other exceptions that mean at this particular time, the standard workforce rules do not apply that would require you to have to return to work or otherwise lose your unemployment benefits.
We know testing is key to fully reopening. We've spoken with several ER doctors treating many COVID patients. They say, Governor, the testing is just not there yet. What do you say to those medical professionals on the front lines?
Remember this, medical professionals who authorized us to reopen include Dr. Mark McClellan, a former head of the United States FDA, former head of U.S. Medicaid and Medicare. We have the doctor in charge of tracing and tracking COVID-19 at the University of Texas Health System, and they all say that what we have in place right now is fine, but they also know what I know, and that is what is coming. What happened earlier this week, it was announced that the United States of America is providing 20 million nasal swabs this month, the month of May, of which Texas will get an amount that through those nasal swabs alone, we would be able to test about 30,000 people per day. And that is just a small fraction of the total testing, because the total testing would include all the private sector testing, which includes these massive amount of Abbott Labs quick response testing that's taking place in increasing amounts. And then on top of that, the Texas National Guard is going out throughout the entire state of Texas, and they are doing about 3,000 tests per day in the more rural regions of the state. So all of these test numbers are adding up, which is exactly why we go back to my point earlier, and that is you are going to find more people are being tested, and as a result, more people are going to show up testing positive. What matters is the percentage of people who test positive.
Speaking of what's coming, Dr. Fauci says a second wave of coronavirus is inevitable. How is Texas preparing for a possible next surge of cases?
So that next surge likely would occur in the fall or as we move toward wintertime when you have both the regular flu plus COVID. And so what Texas is doing, well, we're doing several things. One is we are stockpiling our PPE. We have our own daily supply of PPE that comes in and that we distribute across the state of Texas. As one quick example, we've averaged about a million face masks per day over the past week distributed across the entire state of Texas. We will soon be able to be stockpiling that in large part because of a company located right there in Fort Worth that is manufacturing these face masks for us, and we will have a constant supply of face masks, of PPE, and then secondly, we will make sure that we have available all the hospital beds that we need, all the ventilators that we need, any type of medical equipment that we would need to make sure we will be able to treat all the needs of everyone who tests positive for COVID-19. Very
quickly, we're out of time, but I want to know, will you be out dining at restaurants and heading back to church next week?
I'm looking forward to it. I've been working all day today. Haven't gotten off yet, but I'm looking forward to it.
All right. Our thanks to you, Governor. Thanks for taking the time to speak with us today. And we know